Right. I think the strategies to minimize the risk of animal assisted therapies are really thought of, can be thought of in several ways. Number one are administrative controls. Again, having a program that's formal, that's protocolized, and under the supervision of like the volunteer services of the hospital in conjunction with the infection prevention group or the infectious disease service. That's element number one. The other element in administrative controls is avoiding visits to areas of the highest risk, like bone marrow transplant units, ICUs. You don't go to the kitchens, not to go into the burn units. Another one is to really train the handler. So the handler of the animal knows how to read the dog's emotions, how to keep the dog properly calm, make sure the dog doesn't stray from the leash, knows how to respond in the event that there is something such as a urination or a fecal incident in the hospital. The trainers know how to manage that. And that, last but not least, is the actual animal itself. And that animal should have certifications from a veterinarian, a qualified veterinarian, of being in good health, and that the animal is up to date on the vaccines also. And last, another component of the protocolized visits is before the visit, the animal's sort of paws or should be, the nails should be trimmed such that they don't pose a risk for scratching. Another one is that the fur should be combed through to remove any excess fur, any excess danders, and also to look for any ectoparasites like ticks and fleas. And if those are present, then certainly the animal shouldn't be allowed in the healthcare setting. And last but not least is actually bathing the animal prior to the visit, either the night before or the day of the visit, so that the animal comes as clean as possible to the time of the actual animal-assisted therapy visit. So those are kind of in broad strokes how you can really minimize risk across the healthcare setting with animal visits.